Howdy YouTube family. It is Bolt CRNA coming to you again with another day's topic. Today we're going to be talking about what is a nurse anesthesiologist and how do you become one. Let's talk about it. Now this term started popping up a few years ago, and honestly there was a movement. I think I was a first year in anesthesia school when I first started seeing people in the anesthesia community talking about a nurse anesthesiologist. And the discussion around it back then was patients for decades and decades have not been able to say the word anesthetist or even understand what we're saying. When you say the word nurse anesthetist, they don't know what you mean. They hear a word that sounds kind of like esthetist, and they think maybe you mean esthetician, maybe you mean you do Botox and facials. They don't get it. And then if they do get it after you've explained it to them, they can't pronounce it. There's a really funny meme of Muhammad Ali saying nurse anesthetist because everyone kind of sounds like him when you try and say the word. It's like a tongue twister. Patients, general public, legislators you're talking to, your grandma don't know how to say the word and don't even understand what the word means. And really the word ties over from a Britain word from the UK from a long time ago. And in fact, they still use the word and they say anesthetist. And that's what they mean in their culture, in their medical community. Anesthetist is a physician anesthesiologist over there in the UK. So for whatever reason, 150 years ago when CRNAs were first beginning, the word that we used was nurse anesthetist or anesthetist. And so we've just kind of held over that phrase for 100-something years. So over time, especially recently, people have been saying we need to start adapting to more common words that people understand and people can connect with. And so the thing that people started trialing was nurse anesthesiologist. Another thing that came out was a handful of years ago, the American Society of Anesthesiologists, which is the physician anesthesiologist national organization. They did a study to ask patients and the general public, do you know that your anesthesiologist is a physician? They had a lot of numbers come back saying that no, they didn't know that, or they were unaware of what kind of professional role their anesthesia provider was. So they started to recommend to their members that they should say the word physician anesthesiologist. They should start being specific and letting patients know when they're introducing themselves or talking about themselves, they should say specifically, I'm a physician anesthesiologist. So patients would have a clear understanding that they're talking about a physician and not a CRNA. And so that was another reason why in turn CRNAs started coming up with the idea, well, if they're going to say they're a physician anesthesiologist, which gives a clear, concise understanding to the patient exactly who they are, their role, and what they're doing, why don't we say we're a nurse anesthesiologist? And that way you say, it's a clear understanding that I'm a nurse, but I'm also an anesthesiologist who's going to be providing your anesthesia. And then on top of that, dental anesthesiologist became a thing officially. I don't know how long ago they became official, but it's been a few years now. I know that there's been a offshoot of dentists who have gone on and gotten their training in anesthesia, and they actually can do anesthesia themselves, and their title is dental anesthesiologist. So it's kind of becoming the trend in the anesthesia world that the person who is an anesthesia professional uses the term of what their base title is in front of the word anesthesiologist, and that is the most descriptive way for patients. So yeah, that's why you're seeing a lot of people use the word nurse anesthesiologist in more common vernacular now. And there's actually there's a big vote going on within the AANA, which is the American Association of Nurse Anesthetists, to finally update and change the name and all of the formal verbiage used in that setting to be the American Association of Nurse Anesthesiologists. So that may be happening very soon. There's also a discussion about who licenses us and credentials us, the MBCRNA. They've also been talking about should they be changing so that the certification that they give is changed to the word nurse anesthesiologist instead of nurse anesthetist, which it's currently nurse anesthetist. So yeah, there's lots of stuff changing and going on. That's why you're hearing this word more often. There's no telling where it's going to go from here. It seems like it's going much more in that direction of progress than it would be to stay with the word anesthetist. But currently right now, you can use either phrase you like. And as for how you become a nurse anesthesiologist, it's the same way that you become a CRNA. It's the same thing. The words are interchangeable. So I'll just give you a primer in case maybe this is the first video you've ever seen by me and you don't know. You have to get a Bachelor's of Science in Nursing or a bachelor's in another field while also getting all the science requirements underway and having your RN license, which is going to be an associate's degree in nursing if you didn't do the Bachelor's of Science in Nursing route. Either way you want to go, one of those two paths. There's also a such thing as an accelerated BSN that some people do, which is a year-long program, and that's after you've already gotten a bachelor's in some other field and got all the prereqs done for nursing school, and then you can do a one-year accelerated BSN. But any way you want to go around it, at the end of the day, you're going to have a bachelor's degree, all the science requirements, and an RN degree. And then from there, you have to go get your ICU nursing experience. Now, some programs allow 1 year of experience minimum to apply. Other programs ask for 2. The general number of years of experience that students have who get actually accepted into CRNA school is 2.7 or 2.9 years is the last statistic I saw. So just because you can technically apply with 1 year doesn't mean you'll probably get in with 1 year of experience. So don't let that confuse you when you see 1 year of experience is the minimum amount to even just apply. That doesn't mean they'll actually pick you. And statistically, they probably are not. They usually pick people who have around 3 years of experience. I had 4 years of experience. From there, you're gonna need 3 letters of recommendation. Each program's a little bit different. Some programs require letters of recommendation from your manager. Some programs will ask you for letters of recommendation from like a critical care specialist or a pulmonologist who works with you in the ICU and has like collaborated with you on patients and knows how you work and deal with people. Sometimes they're going to ask for academic letters of recommendation from maybe your nursing program to see from maybe the program director or the dean of your nursing school to see like what was your behavior, academic aptitude back then. So essentially you're going to have 3 of these letters of recommendation. So 3 people have better be able to provide you with some impressive letters. They're going to want your critical care RN certification. You only are able to even sit for this certification after a year of experience in the ICU. So you have to take this exam. It's like $300 each time you take it. I had to take it twice because it's actually quite a difficult exam. I studied for it a little bit beforehand, but you really have to study a decent amount to do well on the CCRN. And so I paid $600 because I had to take it twice, and I passed it the second time. Then you have to take the GRE, which is the Graduates Records Examination, I believe. And it's essentially the test that pretty much all grad schools want you to have to see what your scores are like. It's kind of like how you had to take the SAT or the ACT back in high school. This is like the graduate level version of that exam. It's much harder. It's writing, I believe literature, math, critical thinking, something like that. I've already forgotten. It's been years now since I took it. But it was quite a difficult exam too. And then you have to fly to interview to whatever program you're applying to. If they even accept your application to interview. A lot of people apply, and only a small percentage of those people who apply even get invited to interview. And then out of the people who that interview, there's only a handful that they pick from that. The most recent number that came out was 75% of people who apply to CRNA school don't get into CRNA school. So it's not like if you just apply and meet these other guidelines, you're in. There's a lot of 75% of people who meet these guidelines and don't get in. So the interview is probably where that 75% failed the goal and didn't meet the benchmark, because the interview is very important. And that's actually why I offer a 26-page study guide in my membership plan, the Silver membership, because I use that to help me get into CRNA school, and I want to see other people be able to use that to get into CRNA school too, because the interview is very important. It's what seals the deal for you. And then from beyond there, I have other membership tiers where I do personal mentoring with you and blah, 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 other stuff. So if you're interested in that, go over to the community tab and look into the memberships and join up over there, and I'd love to have you on board. And I forgot, you have to have a good GPA. So by good GPA, I don't mean it had to be a 4.0 that you graduated nursing school with, but I do mean anything less than probably a 3.2 is an automatic no. So you really need to be looking at your GPA, figuring out where you struggled, especially in your science courses, because they're really going to be looking at your science courses and seeing if you made A's in your sciences. If you've made less than some A's, if maybe you made one B in a science and the rest were A's, you're probably okay. But if you made a bunch of B's or even a C, you're probably going to have to go back and retake that science class. And some CRNA programs will ask you to go back and take physics, advanced organic chemistry, biochemistry. There are some programs that require quite a few extra science courses that were not included in your BS in education. Then, so you go through all of that, you say you got in, you interviewed, you nailed it, you got into the program. Now you have a 3-year doctoral program that you have to go to that's going to be like 70 hours a week of time commitment. Whether you're studying in lecture, in clinical rotations, it's going to be 70 to 80 hours a week pretty much for about 3 years, nonstop, no breaks. And then you graduate. And then of course you have to pass boards, which is another nightmare. And it costs $1,000 every time you take boards. If you fail it, you have to take it again, another $1,000. Very hard, very stressful, worst test I've ever taken in my whole life. But after you pass that, then now you are a CRNA or nurse anesthesiologist. Congratulations. Well, all right, guys. I hope that explained that for you. I tried to give a little bit of a background on what this word nurse anesthesiologist means, where it's coming from, where it's probably going into the future. I work within the AANA. I work on some committees with them. I also have lots of friends who are, people in administration with the AANA. I try and keep my ear to the ground on these types of topics. So this is just the behind the scenes ideas of what's going on and what's happening within the association to kind of give you context to when you hear this word on a Reddit forum or you hear some other medical professional bashing the term and being very insecure about things. You have a better understanding of where it's coming from, what the purpose in the phrasing is coming from, and then I gave you the full lowdown on exactly how you become a CRNA or a nurse anesthesiologist. If you have any questions, comments, anything like that, put that down in the comments below. Go over and follow me on Instagram. It's Bolt CRNA over there. I do like daily stories and I try and post pretty often, keep engaged with you guys over there. I'd love to see you over there. Of course, I've already mentioned the membership plan. And if you're not subscribed, what are you doing? Hit that subscription button and that way you get notified every time I do a video and you can come back for the next time. All right, guys, that's Bolt out.